to this webinar on the topic of simplifying alignment. I hope everybody's had a good day at work. Just to let you know what will happen this evening, we are going to play what was a pre-recorded lecture. Recorded it last week, and that's just to keep the flow right. You'll see in the top of your webinar just a couple of boxes there where you can type in questions into the chat room or the questions box, and I'll be able to pick them up at the end of the webinar and answer them. Also, you'll see in the materials section on the top there, there is a little handout which will become obvious why we include that throughout the webinar. So it's 58 minutes long. I'll be here throughout, although I will mute my camera and my microphone just for the duration of the video, and we'll pick things up once the video has finished playing. Hello and welcome to our webinar. This is on the topic of the TrioClear aligner system. This webinar this evening is specifically aimed at general dental practitioners keen to get into aligner therapy. And we're going to talk in quite a bit of depth about the topic of demystifying and simplifying clear aligner therapy. We as dentists really like simple, and if I know one thing about you, it's that you don't want to get wrapped up in complexity on clear aligners, and that is really important in my practice as well, which is why I spend most of my time either looking for simple cases, rejecting moderate to complex cases and referring them on, or de-risking and down-risking moderate cases. The photos that you see in the webinar this evening are all my own unless I say otherwise. One of the really nice things about clear aligner therapy, which I've discovered as a dentist, is that it fits so well if you've got an interest in restoring teeth, particularly front teeth. It fits really well, and the example of the case we can see in front of us is a really good example. This lady had a single veneer placed on the upper left incisor, and it had served her very well, and I think they'd done a good job. It's extremely hard to get that right, and they were almost certainly blocked out of delivering anything else on the right hand side by that crossbite. And so clear aligner therapy allows us to move in on that crossbite, correct it, and then we can restore. We'll talk about this case in a bit more detail at the end anyway. But that's the topic of the webinar this evening, is demystifying and simplifying clear aligner therapy. That's a little bit about myself. I'm called Mark Friend. I'm a dentist. I work in Cookstown in Northern Ireland and do a full range of dental treatments apart from implants. Do a lot of clear aligning, a lot of restoring of teeth. I also work as an advisor for the TrioClear aligner system within UK and Republic of Ireland, and I am also a TrioClear practitioner, which means I use it in practice, and it works. Very briefly, this is an outline of the webinar this evening. We're going to talk about TrioClear and what the company is, just so that you know what our background is. Why should we be doing clear aligners in general dental practice and why it fits so well? How do I find a simple first case and what does that look like? How do I simplify and de-risk my alignment plan if that's needed? Can I combine align and restore easily? And then what next? We believe in the alternating force concept within the TrioClear system. What this means in effect is that every other aligner is soft. And from a patient perspective, this makes them very comfortable and easy to get used to, easy to insert and remove. The hard aligner has got that increased rigidity for the programmed movements. In reality, hard and soft simply means thin and thick. So the softer aligners are 0.5 and then the thicker ones are 0.7 millimeters. We believe in the increased gingival coverage concept within the within our aligner system. I do too. I think it really helps to deliver some of the movements, particularly some of the harder movements. There is an option to scallop the aligner if that's what you prefer, and there will be there's a very easy way to deliver that from a manufacturing perspective. Obviously fully online platform for designing your cases and approving them, uploading. Very, very competent. We will get an opportunity later on in the webinar to see an actual case, and I'll show you an iDesign and how I went about simplifying it. If you're into cone beam and 3D face integration, then the platform can integrate that for you as well. And for those who are really quite techie, there is a mobile app to assist with the uploading of patient photographs. I have used it a number of times and it is excellent. If you like to do your own and plan amendments, the system will let you do that. If you don't like to do that and just prefer to be descriptive about it, then you can also do that yourself. Because we are a global full service laboratory, we are also able to integrate our aligner product with a restore function, and this is really what makes it quite exciting for general dental practitioners, because we're able under one umbrella to align and restore the dentition. So that's really why this makes it clear aligning fits so well into general practice. The retainer package within TrioClear is world class in my opinion. Pretty much anything that you would need or want is available, including jigged transfers, fixed retainers only, whitening retainers, and our flagship Ecodont retainer, which is available in 301 pack. Why clear aligner therapy in general practice? The big advantage in general practice is that we are able to target specific teeth for movement rather than taking a whole arch fixed approach, which is what you would traditionally take with fixed appliance therapy. In other words, every tooth that you put a bracket on and a wire on in fixed appliance therapy will move. Whereas in clear aligner therapy, that's not necessarily always true. We're able to target those moves onto certain teeth and put them into a better position, either for aesthetics or to restore them. Simple cases are really easy to integrate into general practice workflow. I find it fun, and I think it's actually made me a better dentist because I've got a slightly better understanding of how the teeth move inside the arch. I just made an observation as well about orthodontists who I think they're really, because orthodontists look at the face rather than just the teeth, I think their eye for aesthetics is really quite outstanding. And this is something I'd observed maybe around 10 years ago. And I have noticed the more I got into aligning teeth, because aligning teeth makes you step back from the teeth and look at the face, it tends to make you have a slightly finer eye for the aesthetics. Now, how do we find simple cases in general dental practice? More importantly, what do they even look like? I'm going to just give you a very brief overview about case selection. We learn cases in clear aligning by looking at cases. There are some handrails that we will give you in the webinar today, but most of it is just simply looking at teeth in cases and working out whether it's simple, moderate, or complex. I would look at this case in front of us today, and this was a case that I treated. And in reality, I actually would call this a moderate case. Some might call it simple, and we wouldn't criticize them for that. The reason I will call this moderate though is because we do have this anterior crossbite there, and crossbites do tend to be a little bit harder to fix, and so that just puts it slightly out of simple for my liking, particularly if you were a general dental practitioner. However, the moves that we were able to adopt on this case were simple, and so that may well just push it in the lower end of moderate for my liking. This case was treated in 14 aligners with no refinements, and a really nice aesthetic at the end, and really helped improve that smile. If we look at the case on the screen in front of us as well, this is a really nice first case. We can see just that lone incisor on the lower there, slightly lingual to everything else, and using clear aligners we're able to instruct a move on that single tooth using a process called interproximal reduction, just to push it into the arch. And that a very simple case, and very simple and easy to integrate into general practice. Once we learn how to spot those kind of cases, it then becomes a matter of how we go about gathering the data to get the good outcome. And so before we move on to that, I would just say this: clear aligning comes second to the basics. And so whenever you're assessing a case, all those basic things about dentistry, including periodontal support, caries, tooth wear, that becomes your primary focus. And so all of these issues, if they're there, they need to be resolved before you can consider looking at it as a clear aligner case. Dental wear, particularly caries and periodontal health though. And I will show you some cases where it would be quite easy to overlook the periodontal side of things, and then it would become a real problem to you later. Some real contraindications to clear aligner therapy. The X-ray in front of us was an actual case that came to me for a clear aligner consult. And I would say there were no clinical clues as to what lay beneath the gum here. And we can see some really severe resorption. And I can say that if we had engaged a clear aligner onto those teeth, I'm pretty sure they would have come out at some point in the alignment process. So there's a lesson here regards taking x-rays. For sure, I nearly always supplement my radiographs on clear aligner cases. If you take an OPT, they're good, but sometimes you can lose a little bit of focus and clarity on an OPT, so I nearly always supplement them with an IOPA. And I've never regretted it. They're really important. We do still observe quite a number of cases coming in through the Trio Clear platform without x-rays. And we always kind of make an assumption that they are taken somewhere but just not uploaded. But please do take an x-ray on all your cases. It's really important. Some of the contraindications include inappropriate patient expectations. So somebody who's looking for a perfect outcome, and that's a really important discussion to have about perfection, is probably not appropriate for a clear aligner therapy. That would be something that you might want to consider for a referral to consider a comprehensive orthodontic approach. Cases that are likely to go beyond one, maybe two refinements. I will talk to you about what a refinement is and what it means, but most of my cases I'm looking at them and saying, you know, I would really like them all to come over the line just in one plan. If I need to refine it once, that's great, twice at the most. The more cases you do, the better you'll get at, your eye will become at just spotting those cases that might move beyond 1 or 2 refinements. And just to say again, uncontrolled caries and periodontal issues, really, really important to establish and get rid of them first. These are some cases which I believe, again, just if we think about clear aligning, just how to spot a case that we should not be taking on. This is a case that came in to me, again, for an aligner consult. This one has probably slipped through the net in childhood, perhaps, just hadn't had that early orthodontic intervention. There's nothing you can do here with clear aligners in a case like that. This is almost certainly an orthodontic approach required there. That's an interesting one then. So this case here on the top left-hand side of the screen, again, came in for a consult. I thought the smile was actually quite nice. Little bit of a concern about the overlapping centrals and the tooth on the right-hand side here. We did actually submit this for eye design, but as we saw this overlap here correcting, we anticipated a fairly significant risk of the papilla not following the alignment, and it would leave that with a black triangular area of darkness between those two central incisors, which in a smile can be quite aging actually. So I would just be very cautious about overlapping centrals. They can give you a black triangle up there, so just be very cautious about that. I'm not saying don't do them. I'm just saying that they can give you a restorative problem later. So if you're planning to restore afterwards, that's fine. But just be aware of that risk of the papilla not following your aligners. The case in the middle then is obviously severely crowded in the lower arch. We've got some cross bites. The canines are both lying in a very unfavourable direction for anything. You can see the roots coming down this direction here and this direction here. And that is a case that would be extraordinarily hard to deliver with clear aligners. And in fact, I did actually refer that case for a specialist orthodontic assessment, and it's currently under treatment. And there was that ended up requiring extraction of 2 lower second premolars and about 2.5 years worth of fixed appliance therapy. So those severely crowded cases, particularly with roots lying in the wrong direction, they're best avoided. And then the final photograph we can see on this screen here is this, on the face of it looks quite nice, but then think about the periodontium. We do talk a lot about gums in clear aligner work, and we can see some evidence of attachment loss down here and up here. This would be a relatively high risk case for movement after any alignment phase, and so this is the kind of issue with gums that you certainly would want to think twice about taking on. The periodontal issues would certainly need to be resolved before you were able to assess that properly. For me, that case was not one that I was happy to filter into my clear aligning workflow. Couple of cases here. Actually, the case on the left we did actually treat, but that's actually the subject of a separate webinar. Ordinarily, that would be a red case, and the case on the right, severe crowding. Again, this is not to be prescriptive about this, but this is certainly not a simple case. This is a extremely complex case, and so certainly not one which would fit well with a general practice workflow. Again, case on the left-hand side. This again relates to slightly closer up image of what we saw earlier, just this gum issue. This is a lateral incisor that's just drifted out. That was the presenting complaint there. I'll show you the x-ray of that case in a second. The case on the right, we've got this pre-existing fenestration on the lower incisor there, of high risk for recession. So if you moved anything down there, there would be a high risk that fenestration became exacerbated. So those kind of signs there are real good signs just to move that case on and just and don't integrate it into your general practice workflow. Resolve this, but really would question whether that's good for alignment. That's the X-ray of the case I just showed you here, and we can see the bone support around that upper lateral incisor. Totally inappropriate to take that on with clear aligning in general practice. That would be that would almost certainly do for the tooth. It may already be done anyway, in fact, what this really just reinforces just the real importance of taking X-rays before you take on any clear aligner case. So that was just a little idea of what complex or moderate cases actually look like. So that process of selecting a case is actually made easier if we perform a good assessment. You cannot decide if a case really is mild, moderate or complex from photographs alone. You have to do a good assessment, and it's the foundation of your case actually. We're going to talk you through how to assess a case. We've got a very easy to understand and easy to work through assessment form, which you can download, and we'll make that available after the webinar. Later on, we will discuss this case in detail that we can see on the right hand side of the screen. That will be a perfect first case. But otherwise, over the next few minutes, I'm going to talk about this assessment form here. I think it's mandatory for every case. And it just makes you and forces you to record those issues that you might otherwise overlook. And it's a really nice logical sequence. This is what it looks like. On the top, obviously, you're going to fill out the date and patient and your name. And just in the patient's words, just describe what the primary issue is and take a history. That's a nice save actually. We really want you to look at the trauma history, particularly trauma around front teeth. If there is a history of trauma, I'm going to say that you probably would need to consider moving those cases on. That's not hard and fast a rule. It's just a handrail to help you filter out a case that might give you problems. So if there is a history of trauma, those cases can give you problems, particularly with either root resorption or with ankylosis. So you might want to consider moving them on or taking specialist advice on that. This is a case that we're just going to go through and effectively fill in our assessment form. We can see the presenting complaint in this case. So if we look at the primary complaint there, the presenting complaint here was of just slightly butterflied central incisors. They didn't like the appearance of that slightly hypoplastic area on the tip of the central, and they don't like the darkness around here on the right hand side. This area here, for those who might be new to this is known as your buccal corridors, okay? And so there is a section on this in the assessment form, and we'll talk to you about the kind of wording that you can put into that in a second. So here we have the assessment form here, and the first thing it's going to ask you to do is look at the skeletal class. And to assess the skeletal class, you can either look at them or you can take a really nice photograph. And so we have here, this is the photograph that you need to assess the skeletal class. Ideally, this would be slightly chin down. And all we're looking for is just as a visual of this area here. Have we got a lower face height in this lower third, or is it a third, or is it higher than that? So if that, generally speaking, if they are low here, and this is a case where we've got a slightly lower third face height, this would be trending towards a class 2 case. Okay, quite an interesting box there called FMPA, Frankfurt Mandibular Plane Angle, and it's quite a geeky measure. I'm going to show you how to do this on this form here. So you're just going to draw two intersecting lines across the face, exactly as we've got down on the bottom here, and where they intersect tells you if it's low or if it was normal and it would intersect around here. Very cautious about overlapping centrals for a specialist orthodontic. There would be a high risk that fenestration became exacerbated form here. I think it's mandatory for every case. So here we have the assessment form here, and the first thing it's going to ask you to do is look at the skeletal class. And to assess the skeletal class, you can either look at them or you can take a really nice photograph. And so we have here, this is the photograph that you need to assess the skeletal class. Ideally, this would be slightly chin down. And all we're looking for is just as a visual of this area here. Have we got a lower face height in this lower third, or is it a third, or is it higher than that? So if that, generally speaking, if they are low here, and this is a case where we've got a slightly lower third face height, this would be trending towards a class 2 case. Okay, quite an interesting box there called FMPA, Frankfurt Mandibular Plane Angle, and it's quite a geeky measure. I'm going to show you how to do this on this form here. So you're just going to draw two intersecting lines across the face, exactly as we've got down on the bottom here, and where they intersect tells you if it's low or if it was normal and it would intersect around here, or if it was high and they would intersect around about here. And the only significance of this is that if it's a high case, if they're intersecting around about here or beyond, then you might want to consider referring that on. That's called a high angle case. So this is the picture example here on the lower, and high angle cases can be problematic for clear aligners to deliver for a number of reasons. I don't take on any high angle cases in my practice, and they don't make ideal cases. Small changes at the back on high angle cases can create enormous change at the front, so they are generally best avoided. So that's just a little filter, FMPA. It's nice to know about, and it will help you filter out those high angle cases if you record it. Back to the assessment form, nasolabial angle. Okay, just here is a very simple measure. We're just going to look across the nose and down, and if we are at 90 degrees, we circle 90. If we are obtuse, in other words, if we've got a slightly, the lip was falling in here, then that would be known as obtuse, or if it's acute, then the lip would be going this way here. Back to face height. So we talk about face height in this case, increased, normal, or decreased. In this case, it is slightly decreased, but it's not too far off normal. Facial asymmetry here. Everybody has asymmetries in their face, and this one is no different. You just have to spot it. Always tick yes to that. And then try and see where the asymmetry is. So here, asymmetry here, and then we've got this asymmetrical laterals. This guy's not far away from symmetrical. We'll talk to you about the midlines just in 1 second. Are the lips competent when they smile? And they are. And then gingival display, really important to try and see that when they're smiling. We can't see any gingiva here on the top. So that's a nice start point. Tend to find those ones where we're seeing a lot of gingival display when they smile, being quite high risk. Buccal corridors in this case, the simple descriptor on these buccal corridors is that they are quite dark on the right hand side. Otherwise, I would describe them as reasonably well developed. Gingival biotype, incredibly important to write this down. The biotype is, in this case, is thick. We can see really large bands of keratinized tissue here. The thicker cases make really nice clear aligner cases. Thinner cases, and we'll show you some, they tend to be much higher risk for recession during movement. So that's just another way to filter out your cases. And then the rest of this is actually relatively straightforward, the intraoral assessment, which we're well used to doing. We're just looking initially at midlines, and we can see in this case the midline is deviated a long way to the right hand side here on the lower. And so in our form, that's what we would do. The center lines, the lower is deviated to the right, and I would put that by about 6 millimeters. Write your overjet and your overbite in. Sometimes it's hard to see the overbite, and so it's perfectly acceptable to describe this overbite in terms of percentages. So I would call that around about 70 to 80%, which is a relatively deep overbite. And the crowding in this case is mild. There is some. There's rarely none unless we've got spacing. And then we're obviously going to circle what x-rays that we have taken. At the bottom of this assessment form, we're going to write our case summary. So in this case, we're going to write it down as a class 2 skeletal mild crowding case with class 2 division 2 incisor relations. Molars are in class 1, canine class is 1 on the left and 2 on the right. And so that will be your case summary. Up here on the other side of the page then, we're going to write our problem list, and what we're going to ask you to do on this case is write down every single problem that you can see, including problems that you might not necessarily be fixing. So in this case, we would certainly want to write down hyperplastic upper left 1, mild crowding on the upper incisors, deep overbite, dark buccal corridor would be acceptable to write that, shine of the gold crown on the right hand side, and all those problems get listed here. And that then allows you then, from your problem list, it then allows you to write an ideal treatment aim, and you write down a fix for every problem that you've seen up there. If the patient wants all of them fixing, then that then is a comprehensive case. So if they want their deep overbite correcting, for example, and their canine class is corrected, then that will automatically become a comprehensive orthodontic case. So you've filtered it out by taking a really good assessment. You've automatically filtered that case out of your general practice workflow, and that's a case that needs to be referred on. But if in a case like this, the patient is prepared to accept, say, the deep overbite or the canine classes, and only wanted to correct, say, some of that mild anterior crowding, that would be known as a compromise approach, and it's perfectly acceptable then to look at that from a clear aligner perspective. Once you've got your compromise plan, then you've got a provisional treatment plan which you can write in here. And that then becomes the basis for your prescription into your clear aligner prescription workflow. So I would really, really highly recommend this form for every single case that you do. I do them for every single one I do, and I've done lots and lots of clear aligner cases. It really helps you to focus your thoughts on what's actually needed, and it stops you from missing things, which is most important. Quick revision about some of those terminologies actually as well. We all know overjet and overbite. We know molar classes and incisor classes. What is sometimes missed is the cross bites, and so we can see here, I'm just going to give you just one tip. When you look at cross bites, obviously in normal occlusion the upper teeth sit outside the lowers, and in this case, in this diagram, we have the uppers sitting inside, and so these teeth on the right hand side here are all in crossbite. By protocol, we always refer to crossbites by the upper tooth, not the lower tooth. So in this case, we would say the crossbite is on the upper right 6. We wouldn't say crossbite lower right 6. That's just convention, and it's just a nice thing to know. So that's a good assessment. If you do that, then you're ready, and you're happy that you've got a plan that looks like one that you could deliver in a simple way, then you're ready to collect the data. And this is all the data you will need. So you've got your treatment aims and objectives at the start, which comes off your assessment form, radiographs, scans ideally, or impressions we can accept, photographs, really important, and then submit your case for a prescription. Submission of the case for a prescription is slightly beyond the scope of this webinar, but we will give you examples of the kind of photographs that we think are important for you to be taking for all of your cases. Now, how to make it simple. Now, this is the thrust of this. So we make it simple by selecting the right case, and we make it simple by doing a really, really good assessment. And that helps us filter out things which are complex or might land us in trouble later. On the face of it, this might look like quite a complex case, but as your eye gets better with clear aligners, you will start to see opportunities. So this case did come into me actually for an aligner consult, and it does look quite complex on the face of it, and it is complex. The presenting complaint was the maligned lower incisors and the tipped upper left one, which gave it a slightly crooked appearance, and I think it was quite damaging to the smile actually. I can understand why somebody would want this fixing, but we have a lot of occlusal issues at the back, and in aligner work we would sort of call that a cuspy occlusion. It doesn't look particularly stable, and so it's important in a case like this, you know, when you see the complexity at the back, we're asking ourselves, do we want to fix it or not? If we did want to fix that at the back, then that would certainly end up being a comprehensive case, and it would probably result in, you know, 1 year to 2 years of fixed appliance therapy. You can probably work out from the photographs that this person has already had brace work in the past and hadn't had a brilliant experience with it, and they were actually taken off early as a result. So I can kind of understand how the case ended up like this. The question is, can we do anything for them? When we look about simplifying a case, we are looking at it visually and saying, is there any way we can line this up to make that smile look better? So the buccal corridors here are really quite, they're dark and they're narrow. We've got this tooth here seems to be the big issue, but it is a relatively simple movement to push that down with a tip. On the lowers, it's a slightly harder move to upright this. It is slightly harder, but not impossible. We could have a look at an alignment plan that just looked at those front 8 teeth. So we've got the upper 2 to 2, lower 2 to 2. And we can say, is there an alignment plan in here that might give us an improvement on the smile here? We're probably never going to make it perfect. And so that's an opportunity there where we've got quite a complex case, but we might be able to do something simple to just give us an improvement. So let's have a look at the alignment plan, that is. So we can see on the left-hand side of the screen, this is where we are. And on the right-hand side of the screen, this is where we plan to end up. And with relatively simple moves, this was actually an 18-week plan. I'll show you it from a few different angles. This is us from the right-hand side. And we can see those this tooth here just being tipped back into almost edge-to-edge position, actually. But we are trying to finish this class 1 if possible. The design actually was, we were not able to get on the design a full closure of the open bite. We can still see that there. And so from a consent perspective, that needs to be flagged up. So when we see things that might not give us full closure on that open bite, we did flag that up actually at the consent and said, look, we can do some relatively straightforward moves here, but you're probably not going to get things fully together at the front there. The patient was very accepting of that. So we're aiming for an improvement here using some simple aligner moves. By the way, this could only have been delivered with clear aligners because, of course, brackets and wires would have moved everything at the back here. And that's it. Sorry, just from this is a nice view. Actually, you can see the closure of that tooth down here. That there is a really simple move. This one is probably the hardest move in the whole plan. Actually, it's the rotation of this tooth here. That's us at the end of alignment, and actually we achieved a bit more than we thought we were going to get here. We got class 1 actually on our incisor relations, and we did actually get an overlap there, so it was sort of a positive overbite in the end, which we were pleasantly surprised by. I'm just going to make an observation about it. We've improved the alignment, but the smile itself is still probably just not quite, it's not singing at us. So it's okay, but it's not brilliant. And this is where I'm going to really encourage you to think hard about tooth whitening, because it is absolutely, it's a magic combination with aligner therapy. And for 2 weeks of aligner therapy, we were able to turn them from that result there, which is nice, don't get me wrong, but some whitening, and then we get a really nice a nice effect on the tooth. We're able to see some of the mottled areas that we were able to see in the outline. They've really regressed actually under the power of whitening, nice, clean, very healthy looking smile. And we turn it from that to that using some really very simple moves. And all that needs is just top up some on whitening every so often, and retainer wear for the rest of their lives overnight. So that was what on the face of it looked like a very complex case actually, but we were able to deliver it very simply with clear aligners just by using a wee bit of vision on what could be achieved. The more cases you do, the more your eye will drift towards these simple moves and what can be achieved. Right. What we're going to do now is we're going to go through how to simplify and de-risk an alignment plan. And to do this, we're going to go through this case here. And we've deliberately chosen this case because it's a simple case. And it would be an ideal first case. Presenting issue here was the slightly outstanding upper left 2, and we had some mild crowding in the lower incisors. And we have here a nice profile, strong smile, strong jaw, and it passed all our tests for a simple case. It's ideal for clear aligning because we only want to really correct one tooth on the upper and some on the lower. And so we submitted this for an alignment plan. And that is what I'm going to go through with you now, is just the process of looking at this plan here. Actually, that's just some intraoral shots of the same case. So we can see just some mild crowding on these lower incisors here, very mild crowding. And then this tooth here has just wandered out a bit in the smile. And this guy gets married this year, actually, so he just wanted that corrected. So we're going to tab into the Trio Clear portal now, okay? And this is the Trio Clear portal, and so we have here the case, which is this is the splash screen of your Trio Clear case. This is quite an interesting area down here. It just shows you the progress of the case. So this is when I uploaded it, and we can see the various changes that were made, and we're going to show you those changes in a second. The point that we approved it, and then the point that we refined it as well. So we'll go through that. In the portal, if you click this box here called Design, Simulation and Comments box, it will open up a separate tab, and this will take you to the actual alignment plan, which we're looking at in front of us. Now, this was the very first plan that was delivered to us, and this was on the back of my prescription, which we can see, this is my words, and we just wrote, we want very light alignment, upper right 2, 1, upper left 1, 2, lower right 1, 2, lower left 1, 2, especially upper left 2. So just nice and descriptive. Just tell the designers, and that's what we're talking to here. We're not talking to a robot, we're talking to a designer. Just tell them what it is that you want in your own words, and try and keep those words simple. If we look at the plan, you can look at the plan from a number of different angles here. But one angle that I quite like to spin it to is this angle here, okay? It just gives us an idea about the arch. So this is us spun back to the start of the plan. And then as we skip through the steps, we can see the movements that are taking place here, okay? Very small, easy movements. And this is a 10-step aligner case. And then we're going to just spin the low around, and we're going to do the same again. So in every aligner case, pretty much this is what I do. Just go through every single step, and we're just looking at the overall effect. I really like the lower here. I really like this lower plan actually a lot, and that will work, and it did work. On the upper, and we're just talking here about the idea of keeping things as simple as possible. I just became aware in this plan that this patient had absolutely no problem at all with everything on the upper right 2, 1 and the upper left 1. His sole focus was this upper left 2. So I was just looking at this case critically and saying, do we really want to move any of this if it doesn't concern the patient? And that's about simplifying it. So what we're able to do is instruct in effect a refined plan. So I'm just going to click this area here, and this just brings us into the second treatment plan which I instructed. It does take just a few seconds to load up. and so we'll talk over this, but I'll show you my prescription narrative here for the second plan. So all I've written in the second plan is, please do not move upper right 2, 3, thanks, publish as a TP2. So we're going to keep the lowers as is, and we can see now a slightly amended plan where we're going to hold these two teeth here, and the only going to move the upper left 1 and 2. And then we just do a little playthrough on that one again. And we can see it's nicer, it's slightly simpler, but we've had to incorporate some IPR in the two middle teeth to generate that required space. So it's a slightly simpler plan, alignment plan, but we've got some additional IPR to contend with. It's still well within limits, and so we quite like it. However, I still think it could be simpler. And the reason I think it could be simpler is because I think we're needlessly moving these centrals, and we don't need to. So I then would instruct a third treatment plan into this case. And again, it'll just take a few minutes, a few seconds just to load this one up. On the third treatment plan, which is actually the one I ended up approving, I asked the designers to produce a third treatment plan. Do not move upper right 2, 1, upper left 1 at all. Use IPR to tip in upper left 2 and keep the lower alignment the same as TP2. And so we're going to see this plan in a second. And so this then became the simplest alignment plan that I could produce for this patient. And we were happy to go ahead and amend it and approve it. I will just show you, because some of the simpler, because we targeted all our moves at that single tooth, it did mean a slightly increased IPR around those two contacts. So there's usually always a trade-off if you simplify things, but we were happy with that trade-off. It's still a very simple, straightforward plan. Those lower incisors came across in one plan, so that was in a total, because these last two were blank aligners. So those lower incisors decrowded in 8 aligners. And actually we can see here, just in my notes here, we are just having to do a slight refinement on the upper left 2. It didn't quite squeeze in. I would probably blame my inadequate IPR on that not squeezing in fully. I was probably shy on the IPR, which is why that didn't come across in one plan. So that's a really good example of how we simplify an alignment plan. And hopefully that was useful. Align and restore. This will really help you simplify your cases as well, because at the end of the alignment phase, you'll be able to restore to correct some of the imperfections that often appear at the end of an alignment plan in terms of position. So just quickly going to talk about this case that we can see in front of us. We've got obviously this crossbite. We saw this at the start of the process of the webinar today. We've got this crossbite, which we now know is described as upper right 1 and 2 are in crossbite here. What this lady really wanted was veneers, and she didn't like the slightly oil rig appearance of the upper left 1 veneer. Again, I'm not criticizing that. That's just that veneer has served them very well, and she has a very low lip line. So, but she didn't like it, and she wanted it to be corrected. The alignment is actually very straightforward here. We can tackle that lower alignment with clear aligners with relative ease, and then it corrects the crossbite, which then allows us to get in here and restore these two teeth here with veneers, which is ultimately what this lady wanted. We can see this from the right hand side as well. I would describe this case as obviously quite high risk for a session here. and so we don't want to be doing too much with aligners, and that's it from that slightly different angle. It's a fairly significant crossbite actually. So show you the finished case here, and you can see this did involve removal of an incisor in order to give us a better arch form and create space to bring back that tooth in crossbite. Nice arch form at the end of that. You can see we have done some composite work on the tips of these incisors just to create a more uniform appearance in the tips of those teeth. A little bit of restorative work on lower premolars, which helps the smile as well at the front. But we're not doing too much. And then at the end of the alignment phase, we can then move into restore. One of the beautiful things about working in an aligner company that also is a full service restorative lab, and an excellent one at that, is that you can design in beautiful veneers onto your workflow. So in this case, we put a 3/4 crown on this upper right 6 here, upper right 5, just to improve the buccal corridors there. A little bit of composite work on the upper right 3, just to give us a slightly better blend up here. And then we're veneering 2 to 2. We could have grafted up here, of course, but that was declined. I really like pink porcelain on veneers. It works very well, and it gives us that, it loses that slightly oil rig effect. And then up on the left hand side, just a little bit of, if we compare that tooth with this, a little bit of bonding just to improve the emergence profile there. And again, some pink porcelain on the ceramic work at the back. It was a really nice effect down there. Crossbite fully corrected, and in this case we did retain that with some fixed retainers. Interesting just to look at the black triangles here. We did talk about this earlier. We obviously consent for black triangles. It's really important. You don't see them down here. You would see them up here, but down in the incisor area you don't see black triangles in the smile, so the patient tend not to be too concerned about them. And so, but it is important to consent it, and you can see, because we've extracted the tooth, this was always going to be high risk for that, and we can clearly see it. And then for those who are maybe just a wee bit shy about veneers and porcelain work, and things do tend to be driving much more towards a minimally invasive approach on restorative post-alignment. There is this absolutely beautiful composite form injection technique which we have within our TrioClear modern dental system, really made possible by the injectable composites. Our own injectable composite kit comes with genial, a beautiful chameleon-like composite which flows beautifully, and we're able then to use it to create stents for a final restorative design, which are then injected into. I will just talk you through a case that we did here. Sometimes we look at the case from an align restore. Sometimes it's okay to look at it from a restore as well, and here we have a case here that you could very easily have aligned, but just slightly questioning the complexity of the alignment plan and what it's going to deliver for us here. So this actually was a case that we delivered with restore only. I think it fits nicely into an align restore because we can consider it, we got a design done on these teeth. Obviously, we're missing the upper left canine, which the patient's planning to restore with an implant. But we got this design done. Our FIT injectable composite comes with these alternate technique stents, which I'll show you how this works in the mouth. And so you clean up the teeth that you're going to bond and separate the teeth you're not. And then it's an injectable technique. The syringe goes in through the top, and you inject into the tooth, into the stent, cure it through the stent, tidy up, and you can end up with a really beautiful, beautiful aesthetic that personally I would struggle to deliver that freehand. This was upper and lower injectable composite case, and just fits beautifully inside that restore workflow. Minimally invasive. We did not drill the tooth before we touched these. So lovely to think about FIT as FIT injectable composites as well. So, can I combine align and restore easily? Yes, they fit really, really well together. It leads us neatly into just the last part of the webinar today, which is part 6 and what's next. Obviously, from our perspective, we would love to see you sign up to our TrioClear platform to become a practitioner. There you will discover our incredible online platform, and a lot of our downloads, for example, the orthodontic case assessment form are there as well. We run courses almost constantly throughout the year and across Europe relating to Align. So if it's something you need to know more about, then certainly do one of them. But I hope this has been a useful overview of how to look at spot simple aligner cases that are suitable for general practice, and the idea of de-risking your plan to as far as you possibly can. Really thank you for listening today, and we'll be happy to take any questions.
Well, colleagues, that's the end of the webinar. I'm just looking down the question list. There were some sort of specific questions relating to specific techniques. I'll probably get back to those people individually. Otherwise, I don't see any, apart from the slightly glitchy internet, which I do apologize for. I hope you've enjoyed this webinar this evening, and I wish you a very, very successful practicing career. Please do get in touch if you need to learn anything more about this incredible TrioClear Align Restore system.